Good day, and welcome to the Families USA webinar on State of Health Care in Rural America, What Voters Want. Today's conference is being recorded. At this time, I would like to turn the conference over to Kimberly Alleyne. Please go ahead, ma'am.
Thank you, Diana. Welcome, everyone, and good afternoon. I'm Kimberly Alleyne, Senior Director of Communications at Families USA. Thank you for joining us for State of Healthcare in Rural America, What Voters Want. This telebriefing is being brought to you by Families USA Action, our C4 organization. Before we start the presentation, I want to quickly explain why the C4, Families USA Action, is focusing on healthcare in rural America. Here's why. We're battling the nation's gravest pandemic and health-incited recession in several decades, generations. It's a pandemic that is not only putting families' health and health care in jeopardy, it's also robbing them of financial security. It's shuttering Main Street USA and small businesses, and it's also spurring historic losses in health insurance and widespread job losses across several industries, including the healthcare industry. And this is all exacerbated by an election year environment that, as you know, is already very saturated with healthcare messages. We'll see even more saturation the closer we get to the general election. But historically, the importance of rural voters, rural swing voters in particular, is a neglected focus for campaigns, presidential campaigns, congressional campaigns, down ballot. Also, we know that healthcare is a top issue for Democratic voters, independent voters, and quite importantly, swing voters. In fact, according to the Kaiser Family Foundation, more than 1/3 of Democratic voters, roughly about 36%, say that healthcare is the most important issue in their 2020 vote choice, as do 28% of swing voters. And historically, healthcare and the economy are the issues that move swing voters one way or another. So for these reasons, the rural piece, the swing voter piece, and now the added dimension of the COVID-19 pandemic, with all these things in mind, Families USA Action focused on collecting data-backed research on rural Americans to provide new insights. Insights on their attitudes about healthcare and their healthcare needs, how we should talk about their attitudes on healthcare and their healthcare needs, and how we should talk to them about their attitudes on healthcare and their healthcare needs. So these are insights that we think pro-healthcare candidates can adopt and use in their campaigns and ultimately be inclusive of an often overlooked but critically important population. So with that bit of background, I'm going to turn it over to our friend Geoff Garin, President of Hart Research. Welcome, Geoff.
Thank you, Kim. Thrilled to be with you today. Can you hear me, Kim?
Yes, I can. We can
Great.
proceed
well,
to.
Okay. As soon as I don't know who to signal to advance the slides, but I'm fired up and ready to go.
Right here, Geoff. Can let me
Okay.
know. This is Hannah.
Hi, Hannah. If you could just turn to the title slide for the deck. Great, and maybe one more.
Perfect.
Terrific. Thank you very much. So I am thrilled to present the results of a survey we conducted on behalf of Families USA Action with 850 voters who live in rural communities. As you can see, the interviews are recently completed. We were in the field at the very end of July through the very beginning of August. So our most recent interview is only a week old. Hannah, if you'll advance the slide. Let me tell you a little bit about how we got here. As I mentioned, we interviewed a grand total of 805 registered voters. We interviewed them in two components, two chunks. We interviewed a national cross-section of 405 rural residents. So that's representative of rural voters across the country. And then we also interviewed 400 additional rural residents who live in battleground states for the 2020 elections, focusing on states that either will be battlegrounds in the presidential election or Senate battlegrounds. So it turns out, as you'll see in some of the slides, the results between the two different tranches of sample are very, very close to each other. So we're really analyzing this as one. And we should note that because there are some battleground state voters in the national portion of the sample, we are able to combine those with the battleground state focused interviews and ended up with slightly over 550 battleground voters to analyze. In order to make sure that we were talking to the right people, we worked with the Target Smart voter file. Target Smart codes every voter in the United States as either living in an urban, suburban, or rural area based on the density of the community where they live. So we only selected voters off the voter file who are coded as living in a rural area. And then to actually be included in the sample beyond that, when we interviewed them, we asked people whether they live in a large city, a small city, a suburb, a small town, or a rural area, and all of our respondents told us that they live in either a small town or a rural area. We interviewed people by telephone, both landline and cell phone. These are live caller interviews as opposed to the auto dial, press a number on a phone survey that you may have seen. On the next slide, in terms of what our sample looked like, the composition of it, there an almost equal division of women and men. As you probably know, working in this area, the rural electorate is a little older than the electorate as a whole. And you can see a third of our respondents are over the age of 65. This is really influenced by the selection of the battleground states, but in terms of the racial and ethnic composition of the sample, it's overwhelmingly white. There are certainly rural areas that are more diverse. They tend to be in the rural South, but we're, with the exception of Texas, not really part of our battleground sample. People who live in rural areas are more likely than other voters to be religious and attend religious services, and 53% of the voters in our sample describe themselves as either evangelical or born-again Christian, which leads to, in many cases, a very conservative value set on many issues. The party identification, we ask people, do they think of themselves as a Democrat or Republican or an independent? You can see today, by 53 to 38, our rural respondents are more likely to think of themselves as Republicans. And to the extent they think of themselves as Democrats, very often it's not a deep affiliation. You can see the majority of people who identify with the Republican Party feel strongly about it. A slight majority of the people who identify with the Democratic Party say they just lean that way. So there's more intensity to the Republican affiliation among rural voters. And then finally, among the rural electorate, conservatives outnumber liberals by about 2 to 1, although another quarter of the electorate considers himself to be moderate. On the next slide, Hannah. So when we look at the attitudes of rural voters toward President Trump and Joe Biden and the Republicans and Democrats in Congress, what we see here is not that there is a rural love affair with President Trump and the Republicans, but that the attitudes toward Vice President Biden and Democrats in Congress tend to be preponderantly negative. So we'll talk about how well Donald Trump did in rural America, including with many of these voters in 2016. That notwithstanding, he has only a marginally positive favorability rating of 48% positive and 43% negative. But that compares pretty favorably to voters' attitudes toward Joe Biden, who only has a 31% favorable rating. And a majority of rural voters, 55%, say they feel unfavorably toward him. We allow people to say they're neutral or that they never heard of the person. In the cases of Trump and Biden, they're neutral as opposed to unaware. And then a similar story with the two congressional parties, that it's not that rural voters are in love with the Republicans in Congress. They're very evenly divided about them and with more intensely negative than positive feelings. But they are more clear in their negative views of Democrats in Congress. One thing I do want you to note on this slide here is that for President Trump, you can see the text within those bars. Among those who have strong feelings about him in rural America today, they tend to be more strongly negative than strongly positive, by 37 to 33, which is a notable finding given that most analysts and think of rural America as President Trump's base. On the next slide, Hannah. So we start with the base of what occurred in 2016. Catalyst, which many of you are familiar with, it's another progressive data organization, there's a projection after each election using a statistical technique called Mr. P, where they make their best estimate of how voters of different types split in the election. And their projection from 2016 is that Trump won 64% of the rural vote. In our survey, we asked people how they voted in 2016, and 58% recall having voted for President Trump in that last election. So it's a little bit under the Catalyst projection. We don't weight on this basis, in part because people's memory of what they did 4 years ago is colored by their current attitudes. And so we choose not to make this a weighting factor. But we do then ask people, and we'll go through the trial heat results in more depth in a moment, how they intend to vote. And right now, in a sample where 58% said they voted for President Trump last time, only 52% say that they are currently intending to vote for him. So these are the exact same people. We're already measuring a drop-off from President Trump's 2016 performance. And just given the arithmetic of states, very important states in Senate races and the presidential race, that if Donald Trump only gets 52% of the rural vote, there's no way he can win these important battleground states. On the next chart. So this shows you the voting preferences among different subgroups. As you can see here, it's 52% for Trump, as I mentioned, and 37% for Vice President Biden, with 11% either saying that they're inclined to vote for a third-party candidate or that they're completely undecided. I mentioned that our results in the battleground states are not particularly different from what we're seeing nationally, and that's borne out here. You can see the trial heat result is the same across, essentially the same in battleground states as it is overall. Swing voters are an important part of the rural electorate. These are defined as voters who do not have a strong party preference. So in order to get to our sample of swing voters, we exclude anybody who says that they are a strong Republican or a strong Democrat. Doing that is favorable to Democrats because there are more strong Republicans than strong Democrats. But this is a little over half the electorate, 53% of the electorate, who are not moored by a strong party allegiance. And you can see the race is very close among swing voters. There's a gender gap in rural America, as there is in the rest of America, where President Trump is doing better with men than with women. There is an education gap as well in terms of voting, where President Trump has a lopsided advantage with non-college educated white voters, but a more narrow one with college educated voters. Here, we're not talking about young people per se, because we're going all the way up to age 49 here. But younger whites are in rural areas are a little more likely to be for President Trump than older ones, and you'll see a reason for that, and it really goes to the heart of what we are talking about, which is that older voters are much more concerned about issues related to health care, and the more concerned you are about health care issues, the more likely you are to not prefer President Trump and to prefer Vice President Biden instead. And then finally, this kind of religious gap is pretty profound too. So among white evangelical voters in these rural places, they're supporting President Trump by a 50-point margin, 71-20. But among those white voters who are not evangelical, they are supporting Vice President Biden by 50-37. If you can go to the next slide, Hannah. I mentioned the importance of health care in the way people think about President Trump. And this is really kind of most clearly shown in the results with swing voters, which is on the right, that 53% of the electorate who are not moored by party. Swing voters give President Trump a world of credit for his economic policies by 57-36. But when we go from the economy to health care, we have a kind of a dramatic change where instead of having a 21-point margin in his favor, as he does on the economy, he's underwater by 1 point with swing voters. So clearly, the more they're focusing on health care as opposed to kind of the economy, which covers lots of different things in people's minds, it's a very different situation. And one of the key findings in the survey is that even with rural voters, among swing voters, and particularly voters who have already defected from President Trump, his profound mishandling of the coronavirus crisis is very central to their rethinking their partisan and presidential preferences. So you can see with swing voters, we go from plus 21 on the economy to minus 11 on his handling of coronavirus, which is a huge swing from one issue to another issue. It shows that rural voters are not monolithic. There's nuance to their thinking, that they draw distinctions between different issues, and on healthcare issues, particularly now related to coronavirus, President Trump is much weaker than if we were only having an election about the economy. On the next chart, please. We identify a group of 8% of the electorate who we're describing as Trump defectors. These are people who said they voted for President Trump, in 2016, but either they're not currently supporting him or at the end of the survey when we ask them again, they are not supporting him. And you can see how important coronavirus is in particular with those voters, where among the people who have used to support President Trump and don't support him any longer, 67% of those voters disapprove of the job that he's doing on coronavirus, compared to only 35% who disapprove of the job he's doing on the economy. And he's slightly underwater with the defectors as well on healthcare more broadly defined. By the way, I should have noted that this item that's labeled rural communities was just, do you approve or disapprove of the way President Trump is handling issues important to rural communities without defining what those issues are. And so that while even on this they give him much less credit in general than they do in kind of his overall handling the economy, they don't necessarily identify him as kind of a rural guy. On the next chart, what issues are most important to rural voters? Well, what happens here is we gave our respondents a list of these 7 choices and asked them to tell us which 2 are most important to them. You can see that for many rural voters, the topic on which President Trump is most strong is handling of jobs and the economy is a kind of a really important consideration in their voting. But what I want you to note is that we really have 2 different items related to healthcare and health on this list. We have both the coronavirus and healthcare, and 53% of all rural voters choose at least one of those. Some choose both of them, but 53% choose at least one. And in a moment, you'll see the profound impact that has when issues related to health and healthcare are important to voters. Women are more likely than men to prioritize issues related to health. Older voters are more likely than younger voters to prioritize issues related to health. And you can see among that group of Trump defectors, people who were for him 4 years ago and not with him now, they are more likely than average to prioritize health care and health issues, as well as the issue of education. And on the next slide, you can see what a difference it makes, a kind of a world of difference, once issues related to health and healthcare are front and center on voters' radar screens. For those 53% of the electorate who say that either coronavirus or healthcare more generally is one of their voting priorities, Joe Biden is leading with them by 58 to 31. And for the 47% who prioritize other things, generally jobs in the economy and very often something related to immigration or border security, they're voting in a much more lopsided way for President Trump by 73 to 16. We know that there's a correlation here. We don't know that there's causation, but it's a pretty good bet that the greater the intensity that exists at any moment in time around healthcare issues, the worse it'll be for President Trump. And so the efforts that many of you are making to raise the prominence of healthcare issues and issues related to health are really very important, because once that's on people's front of mind for people, it leads them into a clear direction than when it's not front of mind. On the next chart, we ask people in an open-ended way, our rural respondents, when they think of healthcare issues, what's most important to them when it comes time to voting in November. So we don't structure the responses. People can say whatever they want, and then we code them and group them together, the like responses together. One theme you will see here in 3 of the top 5 responses is the word affordable. And, the issue of healthcare affordability is a key driver, both with Trump voters and with Biden voters, as well as swing voters. And so affordable assurance, affordable medicines, just affordable health care more broadly. So affordability and the cost of health care is really the leading edge of the way rural voters intuitively think about what's important here. And there's also, it's not totally surprising, given the age of the rural electorate, an emphasis, a top-of-mind emphasis on the importance of Medicare and the importance of protecting Medicare. They're not talking about Medicare for all, by and large. They're really talking about protecting traditional Medicare, as we know it, but we included that as part of the code. The other thing to note here is what is not here is that when people are answering this question, they're not necessarily bringing a rural frame to their thinking about healthcare. They're not, they're talking about the kinds of healthcare issues that voters most anywhere in America might raise in terms of affordability, coronavirus, which is very important to those Trump defectors, and the issue of Medicare. So in addition to asking people to tell us in their own words what's important to them, on the next chart, we also gave people a series of different topics and said, how important is each one of these to them personally? So we don't necessarily ask it as a kind of how important is a voting issue, just please tell me how important this issue is to you personally. And you can see there's a high degree of and people are asked to rate each of these on a scale of 0 to 10, and we're showing you the very top responses of 9 and 10, where there's real intensity. So you can see the salience of coronavirus, slowing and stopping the spread of coronavirus. That's very important to 2/3 of all voters, and 7 out of 9 of the Trump defectors. Then there's kind of 4 other issues, again, 3 of which are anticipated by the open-ended remarks: affordability of health care, affordability of prescription drugs, and protecting Medicare. So all of those issues which come up spontaneously also resonate when we are offering them as stated issues. And I mentioned on the open-ended question, people don't mention, don't necessarily volunteer things that are specific to rural areas. But here, when we ask specifically about access to hospitals and emergency room care in rural areas, 58% say, yeah, that's something that's very important to me. There's some nuance to this result that I'll go over in a minute, but you can see it's not, this is an issue that is of particular importance to the Trump defectors. So the Trump defectors care very much about slowing and stopping the spread of coronavirus. I think that's the leading edge of what caused them to dump Trump. But they care very much about access to hospitals in rural communities, and they care very much about lowering the cost of prescription drugs. When we ask about rural issues here, there is a high level of concern about access to hospital care, but less about access to specialized medical care, and less about the need to recruit doctors to practice in rural areas. So to the extent we're talking about access to to health care in rural areas, it appears to be very specific to hospitals and emergency room care. For many years now, our political clients have asked us to poll about the saliency of the opioid addiction crisis among rural voters. And what we're finding here is what we've been finding for the past 3 years, is that, relative to other aspects of healthcare and health, the opioid addiction crisis is less broadly salient among voters. If it's happened to somebody in your family, it obviously is very powerful. But if not, there are other issues that become more important. And I don't want to say that the opioid addiction crisis is unimportant in any way, but what I tell my candidate clients and political clients, if you're organizing your rural healthcare agenda around the opioid addiction crisis and you think you've checked the box on rural healthcare by talking about opioids, you're really missing something, and that's confirmed in these results as well. On the next chart, while there is concern about access to hospital care and emergency room care in rural areas, we are not measuring a profound sense that this is a crisis today. So I think a lot of these concerns are more future-facing than they are kind of what might happen to their community as opposed to what has already happened in their community. Here and in one other place, we focus particularly on affordable dental care. There's actually as much sense that that's a problem for rural voters as it is as access to emergency care, hospitals, and specialized medical care. We may have gotten a slightly different result if we did not mix in the specialized medical care here, because as you could see on the previous chart, it wasn't as salient as the issue of hospital and emergency care. On the next chart, part of what we did in the research is we gave voters a series of criticisms of President Trump and his health care record. You'll see this goes over 3 pages of slides. On this first page, there are 3 issues that really stand out as the most potent and powerful. There's one other among the defectors that would kind of join the list as a top tier. But some of this is very reminiscent of the very effective campaign that Democrats ran against Republicans in 2018. So the first item is very much in that vein. The President Trump and the Republicans would allow insurance companies to charge people higher premiums or deny them coverage entirely if they have a pre-existing medical condition, and they favor letting insurance companies charge people over the age of 50 more for their coverage. So kind of referring to what the AARP had referred to as the age tax in their replacement plans. You can see that that's very powerful. 62% say it gives them either major concerns or some concerns about reelecting President Trump. And half of all voters say it gives them major concerns about reelecting him. Among those defectors, just looking at the very top box response, 65% say it gives them major concerns about reelecting him. The other 2 things that are kind of in this category, again, are anticipated by what we saw in the previous chart. The way that the drug companies are jacking up the price of medicines, but Trump is giving them tax cuts and refusing to give Medicare the power to negotiate for lower prices. There's a lot of power and salience in that. And then there are attacks on Medicare, including cuts to rural clinics and increasing the retirement age. So this is not so that there is a sort of a clear case against President Trump. among rural voters that has credibility and power. And if you're communicating with rural voters, we recommend focusing on these things. It's not that they're the only concerns, but they're the most salient ones. On the next chart, you can see while all of the previous items were in the 60s, here these items are in the mid-50s with a little lower level of intensity among the defectors. But you can see that there is some power, again, less than on the other issues, on what they want to do to Medicaid as a source of affordable health insurance, and its importance for rural health care and their efforts to cut it. So there is some power there. His role, we asked about a matter of environmental health. That is not health care, but he's just doing things that make it more likely that people are going to need health care. And there's some salience in that. And then his push for a complete repeal of the Affordable Care Act with no plan to replace it, and really explaining what that means specifically for rural voters. Losing coverage, $1.7 billion in cuts to rural hospitals, a loss of 38,000 jobs. Again, these are all good issues, but they are kind of a step behind the ones we identified earlier in terms of Medicare, pre-existing conditions, and the age tax, and drug prices. And then finally, there are two others on the next chart, Hannah, that test at a slightly lower level. What did the least well was one that sort of tied doctor shortages in rural communities to Trump's immigration policies. That was not particularly resonant. But for the defectors in particular, just his terrible performance on coronavirus does carry some weight. And again, we believe, based on this research, that coronavirus is an important piece of what has driven defections from President Trump among rural voters. On the next chart, we should note that while we criticize President Trump here, their criticisms of Democrats have some countervailing power. So, we said, we criticized the Republicans for siding with big insurance companies and drug companies. The Republican healthcare policies would eliminate coverage, raise costs for many working class families, people with pre-existing conditions. But against that, we talk about socialized medicine and raising taxes. Their attack back is pretty good. And among swing voters, for example, that, we come out, with a slight deficit. With the defectors, our criticism of the Republicans are more powerful. But we should be aware that when the Republicans attack Democrats for supporting socialized medicine and wanting to let government control people's health care and raise everybody's taxes to pay for it, that there is some resonance to that, and so to the extent that we can avoid sort of leading the discussion into that at this stage, between now and November 3rd, so much better with rural voters. On the next chart, in addition to telling them what's wrong with President Trump's record on health care, we also presented different aspects of Vice President Biden's rural health care agenda. Here we were kind of being pretty explicit about the rural part of this. And if we had included things that are kind of more broad, that he favors cracking down on drug companies and giving Medicare the power to negotiate for lower prices and things of that sort that you would say to voters anywhere. We think that they may have tested even better. That's our experience with other kind of research that we've done. But here, in terms of the rural specific agenda, people like very many elements of it. Again, I noted the dental care had some power in a previous slide here. Of all of the things we tell people, that he wants to add dental coverage to Medicare and provide more support for dental coverage in rural areas. That's one of the most popular things that, in a positive way, that we tell people about Vice President Biden's rural healthcare initiatives. People like the fact that he wants to improve telehealth to provide greater access to mental health care and specialty care, funding for community health centers, more funding for rural hospitals. So, there's a kind of, it shows an awareness of the needs of rural areas and a focus on helping rural communities. But one of our takeaways here is that you don't always and only need to talk to rural voters about quote unquote rural health care. That, as I said, some of these broader issues of pre-existing conditions and AIDS taxes and high drug prices and the tax on Medicare all have power with rural voters as they would with voters in other parts of the country. I would also note that the way we talked about Medicaid in our attack against President Trump, if you could go back 2 slides, or 3 slides, I'm sorry, one more. Here, many people depend on Medicaid, essential for the survival of rural hospitals. We're not really putting kind of necessarily a low-income frame around this, and that we talk about Medicaid as being kind of a general, much more of a general good, and kind of even if you're not getting it, it's improving your health infrastructure. And then if you could go ahead to that 3 more slides again to where we were. When you're talking about, Medicare expansion is just about low-income people. That with rural voters who are pretty conservative, it has a little less power. So on the next chart, there's already been erosion for President Trump with rural voters that we attribute in large part to what's happening in healthcare. From beginning to end of the survey, we don't knock down President Trump's vote very much, but we do increase the Biden vote by a little bit. So the margin which started out as 15 points in Trump's favor narrows to 10 points in Trump's favor. And again, if it's anywhere close to 10 points, or even really 15 points in rural communities in November, on November 3rd, it's really, all she wrote for President Trump. So continuing to prosecute these issues are important for making sure those who already defected continue to be defectors and don't go back home to President Trump, that we continue to narrow the gap with voters in these areas. And finally, if you look at this next chart, let me just sort of summarize what our key takeaways are here. First is like a kind of really a recognition that healthcare issues move rural voters. It's as simple as that. Coronavirus and healthcare already have caused people to move away from President Trump in his rural base. Remember, this is supposed to be his base. And the more these issues are front and center, the more likely rural swing voters are to support Biden. So the more we can do to have them be front and center, the better. Affordability is very clearly for electoral purposes the leading edge of communicating with rural voters, and that's the affordability both of insurance and health care itself, and then the affordability of drugs, which is a very powerful issue. And this core critique that was hurt Republicans in 2018 caused a lot of turnover, including in some rural districts, that the Trump Republican health care plan allows insurance companies to charge people more, deny them coverage altogether if they have a pre-existing condition. It would let insurance companies charge older people much more for their coverage. That continues to be powerful. Just nationally, a majority of Americans say that they or someone in their household has a pre-existing condition. It's actually larger than that in rural voters. So you're talking to people, when you talk about letting insurance companies charge more, people are taking this very personally. And when you talk about the age tax, it's also personal to them. So, there's a kind of a powerful bread and butter, nuts and bolts case against Trump and the Republicans that we should continue to prosecute. And then, Medicare being the third leg of the stool in kind of the court case against Trump with rural voters, Trump and the Republicans with rural voters. On the next chart, we should talk about access to hospitals and emergency room care, but we should be a little bit nuanced in how we talk about it. People don't necessarily see it as a current crisis in their own community, but more as a future danger. And so that we want to talk, we don't want people to have to believe that their rural hospital is already gone for them to be concerned about this. That we just really want to create the sense of the danger that their own rural hospital may be in, and relate that to things that President Trump and the Republicans are for that are making that worse. And again, just this broader admonition that it doesn't have to be rural in every sentence when we're talking to rural voters about health care. The broader issues of affordability, Medicare, and the need to control the spread of COVID are very powerful, even without the words rural in them. We're hoping that there will be a Biden presidency with a Democratic Congress that will pass real health care reform in 2021. And it's clearly important to build support for the expansion of coverage. But for the sake of the election, or during this election period, in terms as a voting issue, affordability really is the prism. It's more important than expansion of coverage, and definitely so when we're talking about expanding coverage as kind of something for low-income voters. And we just need to be mindful about the resonance of kind of the charges of socialized medicine. Those charges don't really come into play when you're talking about affordability or protecting Medicare and things of that sort. Again, after the election, we also are going to need a very aggressive effort in rural areas to make sure that there is support for a significant health care reform. But for these next 3 months that will remain in the campaign, it's really about affordability, Medicare, and COVID, and rural, and making sure our rural hospitals are still available. And then just in terms of who you're talking to, the best audiences are women and voters over the age of 50. Drug pricing in particular has resonance with non-college educated voters, a little less so with college educated voters, but the hard part of the electorate, as you remember from that early chart, are non-college educated white voters, and they really respond powerfully to the issue of of drug pricing. And then finally, while we intuitively think of seniors and Medicare, part of the reason that seniors are dropping off from President Trump, which has been reported on in many national polls, is their heightened concern about coronavirus. And for them, that's an important matter to put front and center. So with that, I don't know if people posted any questions, but if you have, I am thrilled to answer them, and otherwise look forward to hearing the other speakers.
Yes, thank you. Wow, lots to unpack there. Lots of interesting and surprising. At least I find some of the insights surprising, for sure. Did anything surprise you, Geoff? Anything that stuck out for you?
That's a great question, Kim. Look, I was, I think kind of in the first instance, just surprised that, how much President Trump's stock has fallen with rural voters and how central healthcare is to that. And, to me, the kind of the big wow piece of data is the difference in voting preferences between the 53% who care about healthcare and the 47% who don't. And it really, shows the importance of making sure that healthcare is salient and front and center. And, we're not, that's not necessarily happening. That's not what people are hearing about in the news every day. They certainly hear about coronavirus, but they're not hearing about these issues of affordability. We're not having legislative fights over them that are kind of, that anybody kind of really notices in the way that, in the 2018 election cycle, there were these big fights over health care that really were very visible to voters. They were very aware of. So, it takes more work now to have these other healthcare issues be part of the equation for people, but that it's work that really pays off.
Indeed. Well, thank you so much. We're going to move to Q&A a little later, but before we do that, we're going to move to the next part of our agenda, which is the consumer perspective. As you all know, raising the consumer experience through storytelling is very central to our work. And I am delighted to have Tamara Hamilton with us today. Tamara is a consumer from Mancos, Colorado. Mancos is a rural part of Colorado. And Tamara is going to share with us a few reactions to some of the data that Geoff just explained and went over, and also her experience with healthcare living in a rural area. Welcome, Tamara. Thank you for joining us today.
Thank you for having me. This has been very interesting, listening to that part of the presentation. All I'm left with is, wow.
Indeed, I got a little glimmer of hope listening to. We're doing the right work, right, on healthcare if we're going to try to move people. So that's encouraging.
Yes, it is.
All right. So Tamara, you live in Mancos, Colorado. In what part? Just help me out here. In what part of Colorado is that? I know it's rural, but where is it?
So Mancos is one of the 3 towns that's in Montezuma County, and Montezuma County is the furthest southwest county of Colorado. Here the addresses are measured on a grid system that is based on how far you are from Utah and how far you are from New Mexico.
Wow. Every time I talk with you, I learn something new. Every time. I'm not kidding. So are you a native of Mancos?
I am not. I have been here for 22 years. I grew up in a very rural part of California and then spent intervening time in big cities.
Got it. So then I'm curious, just a little nosy, what prompted you to move to Mancos, of all places?
Well, took a protractor and drew 50-mile circles around colleges that offered teaching credentials, and then picked on the basis of the highest elevation and lowest snowfall. So I'm within 50 miles of Fort Lewis College in Durango, and I'm at 7,000 feet and get almost no snow at all.
A very smart approach, indeed.
I don't like shoveling.
I don't either. Maybe I need to get my protractor out. But anyway, this is a conversation. So thank you for entertaining me on that. But Geoff laid out several compelling takeaways from the survey. For me, affordability is probably the one that stuck out the most. Health insurance, RX costs, care in general. What did you find the most compelling?
Oh, goodness, I have so many notes here. I was surprised that more people didn't express concern about access, and then I wondered if that was perhaps due to a rural definition of what my area is, because here, given access issues, my area goes into other counties and is probably about an 80-plus mile circle from home. That's also pretty much out of the range of a useful ambulance ride.
Right.
It just, definition of what my area is might play into that, but I was surprised that access was not considered a bigger issue. Certainly affordability, that does not surprise me. This corner, in fact, all of what's called the western slope of Colorado has significantly higher insurance costs than the Front Range does. And that was something that was going to be addressed during this legislative session, but then that got scrapped for COVID responses.
Right. And speaking of COVID-19 and the pandemic, your grandson Tucker had a scare early on in the pandemic, and I was wondering if you could talk to us a little bit about that.
Absolutely. Mr. Tucker came down with very high fever and had trouble breathing, and his pediatrician identified him as presumed COVID and had him go to the ER, where he was tested against flu and RSV, but they did not test him for COVID because at that time they were not testing children according to their guidelines. And so he did have pneumonia. He did not have RSV. He did not have flu. He won't show up in any statistics because he was not tested, although he was officially diagnosed. He was seen at two different ERs, our closest one and then the one that's about 60 miles away. And he was seen 3 different times attempting to receive the care that his pediatrician had requested. And there was a disconnect between the ER doctors and the pediatrician, such that the ER doctors did not want to actually provide the care that the pediatrician wanted him to receive. And we ended up talking to yet another provider up in Denver, which is about a 7-hour drive away. And they said, if you can't get the care there, you need to bring the child here. And that saying that we were going to leave for Denver is what actually finally got him the care that had been requested. But it was a challenge. He did recover. He is well now.
Thank goodness. Thank goodness. And I wanted to talk to you about access more broadly. If you could just describe for us what accessing care, I mean, that's one example. Tucker's story is one example, but what is accessing care in Mancos like for you and your family, on a more general basis?
On a more general basis, we don't receive care because the providers there's such a shortage of health care providers. All of them in this county are part of the same medical group, and they have enormous wait lists such that when you call, you can schedule an appointment for about 3 months in the future. And unless this is, I don't know, an annual well check or something, this isn't terribly effective because if you're sick, in 3 months you're either going to be better or you're going to be dead. I mean, the choices are not too dramatic. There's not a lot of point in being seen in 3 months.
Right.
And I had that experience. I was exceedingly ill and attempted to be seen. The receptionist told me when she could schedule an appointment. I told her that really wasn't acceptable because I was concerned about whether I might even be here in 3 months. And she said, well, that's not very nice. It's like, well, that's my concern.
Right.
When I did finally get there, they said I may have had a heart attack, but it was too late to know.
Unbelievable. And that was it? That was the final answer? We don't know?
Yeah. We don't really know because, by now various blood enzyme levels are inconclusive. And, I did actually go to urgent care, which, those are your choices, urgent care, ER, or wait 3 months. And urgent care told me to schedule an appointment with my doctor. So I did, 3 months later.
Unbelievable. Well, thank goodness you and Tucker are both doing better today. My goodness. And, Geoff mentioned that about half of all voters picked either healthcare or COVID-19 coronavirus as one of their top voting priorities. Does that ring true with you? I'm just wondering what your own top voting priorities are.
Mine would be healthcare and the environment, because I feel like COVID's part of it's part of healthcare. I wouldn't separate it out.
Right, I totally agree. And then what are under the healthcare umbrella, what are your top concerns? I know you talked about access, but are there other items?
Well, what I would love is for anybody else to have access to full and complete care, which is not necessarily the same thing as insurance. Insurance may or may not provide care. And my experience when my son had cancer was that the doctors involved in treating him were thrilled that he had Medicaid because Medicaid simply covered the treatment that the doctors chose rather than them having to get permission from the insurance company and having the insurance company tell them what treatment they could provide. And that was really eye-opening for me because I was kind of embarrassed to say, well, he's got Medicaid. And the doctors were thrilled. Everyone should have access to that, to receiving the care that their physicians want to provide rather than care that is limited by an insurance schedule.
Yeah. We definitely agree with you. And Medicaid, expanding Medicaid is certainly a core part of our work. And we are calling on Congress, demanding Congress, Senate Republicans in particular, to pass not just legislation, not just another package, but monumental legislation that includes universal coverage, and not just what some people would call COVID care. So we're putting the pressure on. I'm curious, what would you say, with that frame, what would you say to Senators Gardner or Bennett, but Senator Gardner in particular? What would your message be to him?
Well, I would ask Senator Gardner to consider all of the residents of the nation and his state, and to actually provide legislation that provides medical care for all. Everyone should be healthy. Everyone should have access. One shouldn't be making decisions about, can I afford to go have this looked at? That's how people end up dying. It's how they end up costing the system much more because they go to the ER rather than receiving preventative care. And I would ask him to work a little harder to actually pass legislation that accomplished that.
We're here for that. Tamara, thank you so much. We really deeply appreciate you being here to share your story and just being such a great partner and healthcare advocate. As I said, every time I talk with you, I learn something new. I think that's because you're a former teacher, and of course, I love teachers. So important. So thank you. Please keep telling your story and keep writing Senator Gardner. So important. We have to keep the pressure on and let him and other members of Congress, Senate Republicans in particular, know that actually the economy and healthcare are inherently intertwined. They are not separate issues. So thank you for being here today, and thank you for all you're doing for healthcare.
It has been my pleasure. I really appreciate the work you're doing.
Thank you so much. Okay, so now we're going to launch, and I know we're over a little bit, but we just feel like this is such an important conversation. We don't want to cut it off. Just want to give space for any questions. So we're going to launch into our Q&A session now just for a few moments. So Hannah, are there any questions in the chat box?
There's one from Alleyne. It states, your thoughts on payroll, tax, holiday, and funding of social. And this was during the earlier presentation.
Can you read the question again? And did you say this is for Geoff? This came up during the presentation?
Correct. The question was, what are your thoughts on payroll, tax, holiday, and funding of social?
Well, we've tested, not specifically among rural voters, but just generally, a long list of items that could be included in COVID relief and recovery bill, and we've done this many times. Every single time we have found that payroll tax cuts are at the very bottom of voters' priorities for what ought to be done. It's not necessarily that they're kind of mixed in their attitudes toward them, but relative to kind of virtually anything else you might put in a bill to help people or to stimulate the economy, this is the thing that is least supported. And then, the version of it that, people do not want to cut payroll taxes if it means defunding Social Security, which is, what the implication would be, because, there's no reason to think Congress is going to go put a lot of general revenue funds into Social Security, and that's really not what Trump wants in any event. And I don't know if you've seen it, Vice President Biden's campaign has a new ad out today on this very question of of Trump's proposals to defund Social Security by this manner, and I think they're very strong.
Yeah. Excellent. Thank you, Geoff. Hannah, any other questions?
Nope.
Okay. Well, again, thank you, Geoff. Thank you, Tamara. If there are no other questions, that means we've reached the end of our time together today, our Families USA Action telebriefing. As we close, just quickly, I just want to ask that you stay in touch with us. Today's telebriefing is just the first in a series of work that Families USA Action is doing to shine a light on rural America and the people living there like Tamara. In the very near future, we will be releasing materials that highlight various problems and barriers to health and healthcare in rural America and our policy solutions to fix those barriers. Ahead of that, we wanted you to have this data just as soon as possible to aid your work in your respective geographies and communities. So please stay tuned. Our fantastic partnerships team will be in touch once our materials are ready to share. Until then, on behalf of our founder, Phil Villers, our leadership team, our wonderful staff, and our C4 Board of Directors, just a huge thanks to Tamara and Geoff, but also to each of you, our partners who are on the line today or who will listen by recording later. We thank you too. Without you, we won't achieve our vision that the best health and health care are equally accessible and affordable for all. Thanks, everyone, and take great care. Bye.